We are here today with Dara Bartels, CEO and president of Bluff Medical Center, which is super cool.
Yeah.
I am so excited to talk to you because I have so many customers that are new to the area. They might be moving from very far away. They might be coming from a bigger city or another rural community where they've had a provider that they've trusted for a long, long time. And it's really difficult for people coming into a new area and to form new relationships with a medical provider that they trust.
Yes.
So one of the main questions that we're always asked right away is, do you have good health care in your area? And I'm proud to say, yes, we do. And a lot of times I think that even our local community doesn't realize how much Bluff Medical Center is able to do. Tell us a little bit about your facility and all the services that you have to offer.
Our facility is a hospital clinic. So we have one main clinic here in Boston, and then we have 4 outreach clinics. And what outreach clinics means is they're just not on the main campus. And then we also have 2 nursing homes, a memory care unit, which is unique. And then we also have retail pharmacy. And then in some of our clinics, we have them as well. And then on top of that, we have a senior independent living building.
Awesome. And that's close to the hospital, right?
Yes.
So, and for somebody moving from outside of the area, you have just so many providers to choose from. I think this speaks volumes to the organization that you've got a lot of providers that have been there for a very, very long time.
Yes.
And you also have providers that are very, very new and know all the new and upcoming things. How does somebody start that search of how do I pick a provider?
Well, one thing I can say about Bluff is we really take pride in having a connection with your provider. So we have a variety of providers. It's interesting how sometimes you think, well, I don't like how that provider talks to me, but the next person's like, love it, love it. So we really, I've tried really hard to get some of the personalities out on our website. So you can go out to Bluff Medical Center website and you can find a provider, and you can search by specialty, gender, which is kind of unique, depending on what you're looking for and who you connect with. And then you can search through the names. And if you click on it, there's a little video.
Great.
And you can get a sense of the personality. And they kind of talk about how they like to practice. One thing that is really good, coming into the community, if you get established in a church or go to the grocery store, word of mouth is really a strong, that experience with that provider is something that really we lean on because of the great relationships. As you talk about longevity, they've created connections with patients, all of our providers. And we have doctors, nurse practitioners, and physician assistants that really see a full scope of patients.
Right. And that's the cool part too, is that like being able to go in and do that preliminary homework as a new person to the area, just even you can find things out about like, okay, that person has kids, so maybe I would connect with them because I have kids, or, whatever it might be. Just be able to find that information out ahead of time is kind of nice.
Moving to the area, one thing I think is important is having some specialty care here. Like being able to have your hernia surgery or appendectomy or anything kind of that general surgery close to home. People can come visit and not have to drive 50 minutes or an hour, because our tertiary centers that are very strong in cardiac and neuro and those types of things that we rely on them are an hour or so away. So we try to really do things close to home. And I think that's important when you start thinking about what services you may need, because we have dialysis, which is something you don't have to travel for, is great, because that's a long trip to sit for services for 4 hours. And you really need someone to probably drive you there and back. So that takes some time. And we also have infusion services, which has to do with some chemotherapy. So you can have your cancer treatment close, not radiation. We don't have that service, but chemotherapy. And some of the antibiotics that you have to have infusion. I've had low on iron before, so I've had to go get iron infusions. And don't need to drive hours to get that done. And the people in our organization, you really can form a connection with them. And being small, you may see them out. We don't talk about services that are happening, but you end up having a relationship with all staff in the organization.
Yeah, that's cool.